Hello, everybody. We're going to wait a few more, maybe another minute or two to let some more people sign in. And then I will do an introduction and then we will get started. Hope you're having a good day. It's a beautiful day in Indianapolis. I don't know where you all are from, but it's a beautiful, sunny, 82-degree day here. And really enjoying some nice weather here for a change. Some of that heat and humidity's gone. It's going to be a beautiful weekend. As you can see, I'm sitting in a very lovely boardroom. I wanted to do this outside, but I didn't think the camera would do quite well. So we're just sitting in our boardroom here at OrthoIndy, and I'm not wearing a mask because we are social distancing. And I've got a great assistant here to help me tonight. You may see an arm come into the view every now and then because this is something new for me. And I don't want to mess it up, so my lovely and talented assistant Ashley may have to reach over and push a button here or there. So don't be alarmed if an unexplained arm suddenly comes into the screen. So anyway, we'll go ahead and get started. I'll tell you a little bit about myself, and then we'll move into the presentation. My name is Eric Monesmith. I'm an orthopedic surgeon, board certified through American Board of Orthopedic Surgeons. I'm a total hip and knee replacement surgeon here at OrthoIndy. I've been a practicing orthopedic surgeon for about 21 years. I've put in thousands of total knees and hips over the years, and that's the prime focus of my practice and what I enjoy doing the most. I also do some knee arthroscopy still, but pretty much just knee and hip replacement at this point. And tonight we're going to be talking, the title of the talk is How to Get the Most Out of Your Joint Replacement. And we'll have plenty of time for questions, and you can always type in your questions into the area on your screen, I think, that allows you to type in questions as we go, and we'll get to all of those at the end. Some folks have already sent in some questions, and I'll get to those at the end as well. So without any further ado, we'll get going here. So the title is How to Get the Most Out of Your New Joint Replacement. And the reason I decided to do this is people often come into the office 6-8 weeks after their surgery. Some people are doing great, and some people are still struggling a little bit. And so over the years, I've come to figure out what it is that you need to do and what I need to do to ensure that we have a good outcome together. So we're going to do a little, here's a little outline of tonight's presentation. You can see the anatomy of the hip and knee. We'll go over that, why someone may need a joint replacement, the 6 P's of surgery and recovery, and I'll explain what the 6 P's stand for, what you can expect before, and how you can do some things before your joint replacement surgery to have the best outcome, and what to do after. And then we'll talk a little bit about modern joint replacement benefits, because I think there's a lot of misinformation out there in the lay public about what a modern joint replacement is. So let's talk a little bit about anatomy. So the anatomy of the hip, you can see, do I have a pointer here? Do I have any kind of pointer I can show on the screen? No? Okay. So on your left side is a diseased hip. On the right side is kind of a normal pelvis picture. You can see the bones and the ligaments. And arthritis is really when you lose the cartilage. All of our joints have a little cartilage cover. Cartilage is surprisingly not very thick. It's only about 3 or 4 millimeters thick on each side of the joint. And so you've got to walk around on 6 or 7 millimeters of cartilage and try and get through your whole life with that. And you begin to understand why these joints might wear out. Joints, or the hip joint in particular, usually wears out at a younger age, believe it or not, than the knees. All of our knees go bad. But hips go bad because of usually of anatomic abnormalities. This is a picture of a hip replacement and then an x-ray. So on your left side of your screen, you can see a representation of a hip with the metal stem going down into the femur, the socket up into the pelvis, and then the insert that goes into the socket with the ball at the top to provide a new hip. And there's an x-ray on your right, as you're looking at the screen, your right side of a hip replacement. And then the knee anatomy, Knee is a very different joint than the hip. The hip, if you go back, you can see a hip is a pretty straightforward ball and socket type of joint. The hip is very different. It has more ligaments, different connections, and so forth. So it makes it a little bit more of a tricky joint. And you can probably see from here, if you have a normal ball and socket, it probably isn't going to go bad, maybe for your whole life. All of our knees go bad over time. You live long enough, you will have knee arthritis. Now, that doesn't mean you will need surgery, but you will develop knee arthritis. So the knee is the femur bone at the top, the tibia and fibula below. You can see your kneecap or patella bone on the front there, connected by your quadricep and patellar tendon, which helps provide mobility and strength. You've got stout ligaments on either side. So there's a lot going on in a knee compared to a hip. A knee replacement, you can see kind of a virtual representation on the left with the blue and the copper being the components, the blue the bone, and then on your, as you look at the screen on the right, an x-ray representation of a total knee. So I had a mentor many years ago who talked about the 7 Ps, and I left one of them out because it's probably not polite to say in professional presentation, but we used to say proper preoperative planning prevents poor performance. And so I think that works for both patients and doctors. And so we're going to kind of cover out how these all come into play, such things as planning, pre and post-operative exercise, proper nutrition, prevention or mental toughness, poor attitude, and performance. So for planning, for my part, and this is what I worry about and what is my responsibility, I need to make sure that you have the right diagnosis before we proceed. I need to do a history and find out exactly what's been going on, what kind of treatment you've had to date, do an exam, take the right types of x-rays to make sure that we have the right diagnosis and the right reasons to proceed with surgery. Then it's up to me to do your preoperative planning, to make sure that we have all the things that we need in the operating room to make sure there's no surprises and that things go smoothly. Then it's up to me also to make sure I use proper surgical technique and get you through and avoid complications. And then what about you, the patient, or if it was me, the patient? Well, one of the things that I've learned is that physicality and mental toughness and attitude are very important. This is a tough thing to get through sometimes, and you've got to be strong, you've got to be mentally tough, a good attitude, and we're going to talk a little bit more about that down the road. Nutrition, compliance, and communication, and we're kind of going to go through all these, and I'll explain what I mean. So physicality, pretty straightforward. The stronger you are and the better shape you are in coming into surgery, the better you will do recovering. Now, of course, it's hard to be in great shape when you have arthritis. And a lot of people say, well, I can't exercise because I have arthritis. Well, I'm just talking about having good control over your muscles, and you can do that with just some very simple exercises preoperatively so that you can ensure that you have good control over your muscles. And then post-operatively, you can start doing the strength training after you've got through the initial recovery, and that's key to your long-term outcome, especially for total knee. Your quadriceps are absolutely the key to getting better and getting the kind of result you want. The quadricep is your big thigh muscle. Proper nutrition. This is a big bugaboo of mine, kind of a hobby, if you will. I think nutrition is absolutely key to overall health and especially towards recovery. And in fact, here at OrthoIndy, we've started an enhanced recovery assistance system that, believe it or not, the old nothing to eat or drink after midnight's now out of thing of the past. We actually have you drinking Gatorade leading up to surgery, and for total joints and spine cases, now we started a protein enhancement program for the week leading up to surgery. But in general, proper nutrition all the time. You should try and avoid processed foods, sugar, avoid consuming too many basic processed carbohydrates. You do want to eat healthy fats, lots of vegetables, good proteins, and some fruits, and stay hydrated. But those top two, avoiding sugar and processed foods and carbs, are absolutely crucial to maintain proper body weight and good nutrition. It also helps you avoid inflammation. Mental toughness and attitude. Recovering from especially knee, not so much hip, but knee, is a marathon, not a sprint. And you can't let yourself get down. You have to stay positive, stay focused on recovery, have a long-term goal, whether it's, I want to be able to walk the golf course next spring, or I want to be able to walk the beach with my husband, or I want to be able to walk the dog, or I want to take my grandkids to do whatever it is. Have a goal that you set for yourself that you can focus on, that you want to do, that you have not been able to do for a while. Self-efficacy is kind of a funny word, but it's something that there's been a fair amount of research on in the past few years in joint replacement, that folks who don't have the ability to function well on their own, or they have depression or mental health issues, have a really tough time with joint replacement and recovery. And so if that is something you struggle with, doesn't mean you can't have a successful outcome, just means you need to communicate these issues with your doctor, so that maybe we need to do some other things before surgery with your mental health professional, so that you can have a good outcome. And I always tell people, look, take a break. You're going to be tired. Think of surgery like an energy requirement. You have surgery anywhere in your body, your body's going to focus some energy into that area. It's going to take it away from somewhere else. So when you need a nap in the middle of the afternoon, when you're 2.5, 3 weeks out from surgery, guess what? Take a nap and let your body recover. Performance. You need to do your post-operative exercises, especially with total knee. That's key to your recovery. However, you don't want to overdo it and be too aggressive too early. You have to take it slow. Remember, it's a marathon, not a sprint. Your doctor most likely will give you physical therapy, especially for a total knee, probably not so much for a total hip. And you need to do your therapy and work with your therapist. Take the medications that are prescribed for you. You're going to need some pain medicine for the first few weeks, but you do want to wean off narcotics as soon as possible. We know that folks who are on narcotics more than 5 or 6 weeks after surgery tend to be on them at a year, and that's not good for you. But you also will have medications to prevent the side effects of narcotics, like constipation. You'll most likely have a blood thinner type, whether it's aspirin or something stronger, to help prevent blood clots. And then communicate. Don't let something fester until it's a big problem. You want to communicate with your surgeon and their team to let them know if you're having a problem, so that we can help you resolve it quickly. So the good news is that modern joint replacement has a lot of benefits. In fact, hip and knee replacement are probably the two most highly valued, I don't know if highly valued, but is the best value for your dollar surgeries in all of medicine. And that's not me just saying that. That's from the National Institutes of Health, that these two operations restore quality of life for a lot less money than just about anything else, and they're durable. It's a very safe operation now. Our team here at OrthoIndy, we have fabulous internal medicine docs who make sure your health status is as good as possible, so that we can avoid complications. It's a much more reliable surgery than it was 10, 15 years ago. Recovery is faster. I'm not going to sit here and tell you that it's easy or super quick, but it is certainly a lot better than it was 10, 15, 20 years ago. It's less painful than it used to be. Your functional outcomes are better than they used to be. So overall, it is a much better operation than it was a few years ago. So some take-home points here. Joint replacement is proven. It is a great treatment for end-stage hip and knee arthritis. There's a lot of other things we can do before surgery, but if you get to a point where all those things fail and your quality of life is diminished and you're not happy, then don't be scared of joint replacement. It works well, it's safe. I can't tell you how many times people come in and afterwards they say, wow, I wish I had done this 5 years ago, or wow, I wish I hadn't waited so long. If I'd have known it was going to be this easy or feel this good, I wouldn't have waited. It's important to remember those things we talked about, the 6 Ps, to make sure you have the best outcome, and then discuss your options and concerns with your surgeon. The more you know going in, the more comfortable you are going in, the better off you're going to be. The time to ask questions is not the day of surgery. The time to ask questions is, weeks leading up, to make sure that you have all the things you need to know to have a successful outcome. What else here? We're going to answer some questions. Some of the questions that we had from before were, somebody asked, how do you choose the brand of implant you use? Well, good question. There are a lot of good brands out there, and I tell people to choose the archer, not the arrow. In other words, pick your surgeon and let your surgeon worry about the implant. I would say that with a few exceptions, all the companies have solid implants with good long-term track records now, and you don't really have to worry about that. I would pick your surgeon, pick somebody you're comfortable with, let him or her make that decision for you based on what they think is best for you. What do you find most helpful or beneficial thing a physical therapist can do to add success to the joint replacement? I think it is reinforcing, the good exercise habits and encouraging you to stay on top of it. I think strength is probably the absolutely most important thing. Early on after your surgery, especially with the knee, you'll be worried about some swelling and getting range of motion, but shortly thereafter, we need to start working on strength because a good, strong leg is going to allow you to have a much better outcome. And then this one's kind of interesting. What caused my femur to fracture in 2 places immediately after hip replacement? Well, that's a little bit difficult to say. I'm hoping I wasn't there. That's a joke. But probably what happened is during the insertion of the femoral stem, there was a small unnoticed crack in the femur. That does happen in a small percentage of cases. If it's noticed, you can put a wire around the femur and you don't have to change anything. But if it goes unnoticed and then you start walking on the femur, the stems are sort of wedge-shaped, most of the modern stems, and you can propagate that crack down and lead to a fracture in your femur. So that's an unfortunate complication. Fortunately rare. Some other question. I'll bring up a question a lot of people wonder about but are afraid to ask. I was going to put this in my presentation and it didn't get through the censors. But one of the questions people wonder about is what about having sexual activity after a joint replacement? Well, the short answer is yes, you can. And in fact, most surveys show that people are very concerned about that, but a little hesitant to talk to their doctor about it. But after recovery, initial recovery from their surgery, their sex life actually gets better, which, as you can probably imagine, if you have a very painful hip and it becomes painless, that makes these other activities more enjoyable. So there you have it. You want better sex life, have a total hip. So what else? Are there any other questions? No? Well, we're going to leave Ashley's going to leave a link up if you have other questions. And to learn more, visit our website. I think the address will be listed up there for you. And I hope you enjoyed it and found it informative. Thanks.